There's a lot of misconceptions about what it means to be on the autistic spectrum. For starters, it is not just a diagnosis given to people who are good at math and science and have a hard time with S. Social cues. That's a stereotype, and stereotypes hurt people. They can make people feel isolated, ashamed, and misunderstood. Being on the spectrum is a spectrum. It's a range of challenges and strengths. Some people might need support with everyday tasks. Others might be high-functioning. Some people might be verbal. Others might be nonverbal. Some people might have no other health issues. Others might also have ADHD, dyslexia, or dyscalculia. It's important to remember that autistic people are autistic first and foremost. We're not defined by our disabilities. We're not defined by our strengths either. We're defined by our whole selves. Our quirks, our challenges, our passions, and our dreams. Imagine being unable to understand why everyone is upset when you say something that isn't well received socially. You have no clue because your brain has trouble processing other people's feelings and reactions. And this happens all the time, which makes social interactions difficult. If you experience this, you could be on the autistic spectrum. The term autism refers to several disorders related to brain development in which social communication and interaction and restricted or repetitive behaviors and interests significantly affect daily functioning. Autism is also known as Autism Spectrum Disorder, ASD, or Pervasive Developmental Disorder, PDD. But why do some people consider the term autism offensive? What are some of the misconceptions about it? Is there any truth to these misconceptions? To answer this question, we need to know what autism really is. So let's take a look at the signs and symptoms, causes, diagnosis, and treatment of autistic spectrum disorders. Hello and welcome to our channel. In today's video, we will be talking about autistic spectrum disorders. So if you are new here, consider subscribing for more amazing videos. Now let's get started. Autism is not an illness. It is a different way of being. A person with autism thinks, learns, and interacts with the world differently from neurotypical people. People with autism can lead happy and fulfilling lives and make significant contributions to society. Many people with autism are employed and have families. They can live independently or with support depending on the severity of their symptoms. So now that we have established this, why do some people find the term autism offensive? Some people believe that the term autism implies that something is wrong with them or that they are less than other people. This is not true. Autism is just a different way of thinking and being. People with autism have the same value as everyone else. The term autism can be offensive to some people because it implies that there is something wrong with them. However, autism is not a bad thing. It is simply a different way of experiencing the world. People with autism have unique strengths and abilities that allow them to contribute to society in meaningful ways. The term autism should not carry a negative stigma. Instead, it should be seen as a descriptor of a neurodiverse person. Let's move forward with the video and talk about some of the misconceptions about autism. Autism is a myth. Some people believe that autism is a myth and that it is not a real condition. This is not true. Autism is a real condition that affects millions of people worldwide. There is a lot of misinformation out there about autism, and this can make it difficult for people with autism to get the support they need. However, autism is a legitimate condition, and there is no shame in having it. One behavior does not represent autism. Another common misconception is that one behavior represents autism. For example, some people believe that all autistic people are good at math or that all autistic people have sensory issues. This is not true. Autism is a spectrum disorder, which means that it affects each person in a different way. Some autistic people may excel in math, while others may struggle with it. Some autistic people may have sensory issues, while others may not. There is a wide range of symptoms, and no two people with autism are alike. Now that we have debunked some of the myths surrounding autism, let's move on to learning about the signs and symptoms of autistic spectrum disorders. Autism is a complex developmental disability that can cause a range of social, behavioral, and communication challenges. To learn more about the signs and symptoms of autism, keep watching. There are 3 main categories of symptoms associated with ASD: social communication and interaction, restricted or repetitive patterns of behavior, interest, or activity, and other symptoms that may include anxiety or gastrointestinal or G problems. Social communication and interaction. In social situations, people with ASD often have difficulty understanding unwritten rules. They may also have difficulty understanding other people's perspectives, making eye contact, and expressing themselves appropriately. They may also have difficulty developing and maintaining friendships. Restricted or repetitive patterns of behavior, interest, or activity. Repetitive movements such as hand flapping or spinning may be used to meet a sensory need or to self-soothe. Repetitive speech such as repeating phrases over and over may be used to reduce anxiety or to help with communication. Intense, neurodivergent interests are common and may take up a lot of the person's time and energy. For example, the person may become obsessed with a particular topic and spend all of their free time learning about it. They may also become very skilled in a particular area. Other symptoms. Many people with ASD also have other symptoms such as anxiety or G problems. Anxiety is common in people with ASD because they often have difficulty understanding and navigating social situations. G problems are also common in people with ASD. This may be due to a combination of factors, including sensory issues, anxiety, and restricted diets. If you think you or someone you know may have ASD, please seek professional help. A qualified mental health provider can assess your symptoms and make a diagnosis. They can also recommend treatment options that may be helpful. Early intervention is key when treating ASD. The earlier treatment begins, the better the outcomes tend to be. Treatment typically involves a combination of therapy, education, and medication. Let's now move on to the causes of autistic spectrum disorders. ASD is a complex condition that is not fully understood. However, research has shown that genetics and environment both play a role in its development. Genetic factors are thought to account for at least 80% of the variance in ASD. This means that ASD is highly heritable and that most cases are caused by a combination of multiple genes. Environmental factors are also thought to play a role in ASD. This includes things like advanced parental age at the time of the child's conception, complications during pregnancy or delivery, and exposure to toxins. Currently, there is no cure for ASD. However, there are treatments available that can help manage the symptoms. The most effective treatment for ASD is early intervention. Early intervention is a type of therapy that helps children with ASD develop skills they need to succeed in life. This may include skills like communication, social skills, and daily living skills. Early intervention is most effective when it is started at a young age. Moving on, let's discuss how ASD is diagnosed. ASD is diagnosed using a clinical interview and observation. There is no single test that can diagnose ASD. However, there are a number of screening tools that can be used to identify individuals who may be at risk for ASD. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, is used to diagnose ASD. In order to receive a diagnosis, the individual must meet certain criteria. These criteria include having deficits in social communication and interaction and having restricted or repetitive patterns of behavior, interest, or activity. The symptoms must be present in early childhood, and they must cause clinically significant impairment in social, academic, or occupational functioning. In conclusion, autism is a complex condition that can cause a range of challenges. However, it is important to remember that people with autism are just as valuable as everyone else. They have a lot to offer the world and should not be defined by their disability. Autism is not a bad thing. It is simply a different way of experiencing the world. If you or someone you know has been diagnosed with autism, please reach out for support. There are many resources available to help you or your loved one live a full and happy life. What are your thoughts on autism? Do you find the term offensive, or do you think it's okay to use? Let us know in the comments below. We would love to hear from you. Also, if you enjoyed this video, don't forget to give it a thumbs up and share it with others. And if you haven't already, don't forget to subscribe so you never miss out on future videos. Thanks for watching.